Hi everyone. In this clip, I will continue to talk on whooping cough. This is a part 2 of 3 in the series, and please note that anything I record here are for informational use only, and it's not intended to diagnose or cure any ailments. As long as you keep the mucus moving, you should not get a secondary infection. Vitamin C and good hydration will keep the mucus thin, and when you start taking the vitamin C, the mucus may thin out very quickly, and you may bring up large quantities of mucus in the first 24 hours. That is a sign of success. That's a good sign. So I'm actually reducing the jargon drastically and trying to make this easy on your ears, basically. So if the mucus is not coughed up, other bacteria can grow and cause a secondary bacterial infection, which doctors would want to treat with antibiotics again. So just using antibiotics doesn't deal with the pooling mucus or manage the cough or deal with toxins. If you keep the mucus moving, there should be no further problems other than the cough itself. So the earlier in the illness that we start using vitamin C, the fewer bronchial hairs will be lost. Once bronchial hairs are lost, the cough sounds dry, and that's because the mucous membranes aren't sort of being kept as regularly moist as normal. Going back to babies, there are parents all around the world who know that any baby at any age can be managed if a mother is supported and knows what to do. A rocking chair, for example, is a must for parents to conserve energy and be able to easily rock very young babies. This will serve to keep the infant relaxed and the mucus moving. Powdered or liquid vitamin C is good to always have in the house to treat many different external and internal conditions, actually. Please don't use calcium ascorbate or ester C. When using high doses of vitamin C necessary for most illnesses, and especially whooping cough, nobody needs that much calcium. Besides which, the intestines transport the ascorbate into the body using sodium transporters, and for that reason, sodium ascorbate is more biomedically compatible. There's one important key for breastfeeding mothers, especially if the mother has whooping cough. They would need to keep their vitamin C levels consistently high throughout the day and night, because if they don't, their exotoxin can pass to the body of the baby through milk. So they need to efficiently neutralize the toxin in their own bodies. It is possible in the case of mild underlying kidney issues to get some swelling with high-dose vitamin C in sodium ascorbate form in your legs or extremities. If this is an issue, ascorbic acid form of vitamin C can be used with sodium ascorbate to cut down on the sodium that you're ingesting. It's not recommended to use cough suppressants of any kind, or acetaminophen, or fever reducers, or even cold medicines. Fever is the body's natural mechanism to deal with with any disease. However, know that whooping cough bacteria do not permeate into blood, and fevers are not usual in any phase of whooping cough. If the temperature is above normal, other infections should be considered. There's much controversy around vitamin C therapies, and I must say vitamin C is never a poison in the body because we need it for so many bodily functions. And if you ever take too much, you will have an episode of loose bowels as the excess is removed from your body and gotten rid of. This is how you know you've had more than enough. So for everyone to consider that vitamin C would have toxicity, for anyone to consider that vitamin C would have a toxicity, means that they have somewhat limited understanding of the various roles that it has in the body and it plays in the body. There's a huge mass of research literature supporting the truth that vitamin C is non-toxic and it is safe in indicated circumstances, even in megadose quantities. One of the biggest problems, especially in toxin-producing illnesses like B. pertussis, is that people are hesitant to use the high doses that are required. They have been convinced about that how dangerous vitamin C is in large doses. They see 20 to 30 grams for an adult or 5 to 10 grams for a child as an outrageous amount. These seemingly high doses of ascorbate are often only just enough to keep up because the body will use it up very rapidly as it works to cope with ongoing toxin production along with the subsequent oxidative stress. It's like pouring water into a bucket with leaking holes. The vitamin C intake has to increase to keep up the body's need for it. So nobody has ever died of vitamin C overdose, by the way. Anyone with a rare disorder called glucose 6-phosphate, I think it's called dehydrogenase deficiency, or G6PD, which can cause anemia and red blood cells breaking open when certain foods and drugs are given, should not use megadoses of vitamin C except under special care. If you or your family has a history of anemia or G6PD deficiency, consult your doctor who is well informed in vitamin C immunobiology before taking vitamin C. People with this disorder can still take moderate doses when they are very ill. The ascorbate will not kill the bacteria, but it will mobilize the neutrophils and the immune cells that process the infection, which grind to a halt without it, because ascorbate is their fuel. The bacterial toxin forms a barrier to the immune system, and in using ascorbate, you're clearing out that barrier and allowing the immune system to get in and deal with the bacteria. It could still take the whole 100 days to deal with the B. pertussis and start to regrow cilia or those hair-like things. But the patient will have far less serious symptoms because they're keeping the body as clear as they can of the toxins, and the immune pathway keeps functioning properly. Now, I'm going to continue further in the third clip. Please ensure not to try and address any ailments you might have on your own, and contact your healthcare provider for proper steps and attention. Like and follow for more. Be the light.